Welcome everyone to HIMSS22. My name is Lisa Gulker. I'm a Senior Director at Cerner in our real-time health system business. I'm so happy to be here, and I'm also very happy to be here to talk about real-time health system in Cerner Command Center with my good friend and colleague April Giard from Northern Light Health. April, thanks for joining.
You're welcome. I look forward to being here.
Yeah, so a little bit about April. April is a System Vice President with Northern Light Health. She's the Chief Digital Officer. Northern Light Health is a 10-hospital system in the state of Maine and has been a very strategic innovation partner for Cerner for a very long time. And so we're here to talk about how you've used your experience as a leader in multiple roles at Northern Light Health, as well as a clinician. You're a fellow nurse. And we think about patients all the time, even though we don't do it every day the way we used to. And how you've used Cerner Command Center in your work as Chief Digital Officer during COVID, and how we got to the point of getting it live in your system so you could give us some really good feedback. So COVID-19 was a big disruptor for all of us in healthcare, us in the IT side of things too. And we were already innovating together when COVID started. And we were required to do a lot of quick pivots and change direction very quickly. Can you tell us a little bit about how you used the Cerner Command Center during your COVID response?
Sure. I mean, we were, as you said, already innovating together. And so at that time, I was the Chief Clinical Integration Officer and the interim CIO. And we had been on a journey of innovating together and really bringing Northern Light Health forward and the use of real-time analytics and as a real-time health system, and how we're going to use analytics to drive our business and improve access to care. And so as we were building and rolling out the Command Center dashboards, COVID, our first surge of COVID hit. And I remember talking to you and talking to our senior leadership and leaders in the hospitals as we had just rolled out the first dashboard. And it provided so many valuable insights in real time to be able to manage patient flow, where patients were at. And so I remember having to pivot, and because we had a roadmap of where we were rolling out the dashboard next. And we are a 10 hospital system, and one of our hospitals was in the southern part of the state of Maine, and they were really feeling the first surge and the volume and capacity. And we hadn't rolled out there yet to the command center. So we said quickly to Cerner, can you roll out? And we have to go fast, because not only did we see the value, but we felt and saw the value in a crisis that all of us were facing at the hospitals, in the community. And so that was really important. And so I remember quickly Cerner responding to that. And I think, being able to respond to that quickly for us, to use something that was innovative to help us in a crisis, it was really a blessing for us, and a partnership, and showing the true partnership. Because it was cloud-based, it was easy to deploy quickly. And also, we had been on this path for quite some time, and we had in Northern Light data for about 2+ years of Northern Light data that had already been consumed, if you will, running through the machine learning algorithms around volume and census. So it knew and had that information already. So it really was so important for us to be able to do that during that time.
And what you said is so true about the innovative partnership that becomes a habit. So we had that. You were already a core part of our leadership council. You were a core part of our user groups. Our product managers knew your team really well because they were building and we were getting feedback in real time. And I am so happy we were able to pivot, because I do remember you calling and saying, hey, I've got a problem. We got to go faster. And we were able to do it. So it's a really good success story. What was so interesting too is how you described to us during your various pandemic phases of response that we were we were already planning really good workflows around managing bed capacity, managing staff, because those are two important components to deliver care. And then you were talking to me about how impactful the Command Center dashboard was, because it provided you insight into the support teams that were a huge part of our pandemic response. So environmental services, transportation teams. Can you talk a little bit about how that was sort of a surprise, because we weren't anticipating how important those teams were during the pandemic, of course, and then it became apparent. So can you talk a little bit about that?
Yeah, so the Command Center dashboard gives you those real insights in real time. And you know, there's a lot that goes behind that with all those support services. So, you know, to be able to transport patients, throughput is always important. So, you know, throughput of patients, it was always a strategic focus for us, and understanding bottlenecks or where you need to pivot. And the dashboard just allowed us to do that, and understanding the data and the transparency around the beds that we had, the number of beds that were designated as COVID that needed to be cleaned, and then where they were, and then the transport of patients. And so all of those support services, we had so much more insight into what they were struggling with or what they needed to manage, that our leaders saw that. They also saw the predictive, what it was predicting to be in 2 and 4 hours, and what the need was. So our leaders could help those on the front line dealing with this in real time, to be able to say, this is what I see that's happening, and this is what's going to happen. What do we need to do to help pivot, bring resources, and quickly manage that? And that was very important.
And as I said, that was such an important and powerful story as you began to talk to us about that, because that connection to the front line was so important. So we've talked too about sort of the need for, well, the importance of the dashboard during COVID. But before COVID, it was a part of how you were going to take care of patients all throughout the state of Maine. You have a very unique combination at Northern Light of this balance of being really spread out geographically over a very large state, and an amazing spectrum of services: specialty care, behavioral health, local community hospitals. Can you talk about how the dashboard has changed the way you provide service to those communities over such a wide geographical area?
Yeah, so before COVID, again, we were focused on how can we use the Command Center dashboards to not only understand for leaders what was happening at each hospital, but as a system, because our mission is to serve those patients in the state of Maine and keep patients locally with their families, and also to care for those, being able to care for those locally in those hospitals. And those that need the tertiary level of care, you know, we needed to make sure we had beds when the community needed us to have beds, because it served, that tertiary hospital serves a great, very large population. And so this was about really managing 10 hospitals and all the patients that we were caring for and that were coming into us needing services and needing beds for a certain level of care. And so not only could we manage within a hospital, but we could now manage across the hospitals and understand in real time what was happening and where we needed to move patients or keep patients locally and care for them there. And that was that's where we were moving before even COVID hit, and so it still is today.
It's so interesting too how you described that patients do want to be near their families. So if they need to be moved for specialty care, which you now have the visibility to do, that they also were excited to hear you were thinking about moving them back so that they could be with their families in their community for the rest of their stay. And I loved how that was just a part of the feeling when you go to Northern Light Health and get to visit and see that importance. It's really, it's a transformational way to think about being very patient-centered. So I'm so happy that the data is helping you and support that. So What were you doing before? So you described this ambition, and I know it's part of your mission and vision and your strategy, but before you had the data, before you had the dashboards, and the leadership processes that go with it, what were you doing before?
So we were compiling data, nurses, care managers, they would compile data from their units or from what they were doing. They'd bring it down to whether it was a morning huddle or whatever it was, and then they'd present their data and talk about it. Mm-hmm. Well, by the time they collected their data and went to a meeting to be able to manage it, it was already old news. Mm. I mean, that was already old news, and so it was really not helping us move as a system in hospitals to be able to manage operations to make a difference. Because if it's already old news, then you've missed opportunities. And that's what we needed to do. And not only was that, but it was only a hospital-centric. So after each hospital collected their data, came together, then it was phone calls. Do you have a bed? Do you have a bed? When will you have a bed? And that is an inefficient use of very highly skilled clinicians and other executive leadership to be on the phone managing and finding out what our other hospitals in the system had for bed availability or discharges, and that we wouldn't, normal business wouldn't operate like that and be successful.
Sure.
So
sure.
That was really important for us. Yep.
So, and I was at a few of those huddles as we were planning for, again, I've loved the partnership of let us be part of your system, see how your leaders from the frontline staff all the way to your C-suite are working to make decisions every day and in real time, but without real-time data. Mm-hmm. So I've loved being able to participate at and make sure that the visualizations we put in the tool match that need for decision making and really taking some action. Mm-hmm. And that sort of gets us to the definition of what a real-time health system has been. Mm-hmm. So real-time health system is where I work at Cerner. What does it mean in your mind as someone who's, as I said, a clinician at heart, and you're a fellow nurse practitioner, and we work with data all the time and make decisions when we take care of patients. So when you are taking care of patients at scale and trying to become a real-time health system, what does that mean as a chief digital officer now in your role?
Well, what it means, I think there's advantages for real-time health systems that we're going to be able to really nail, if you will, or accomplish access to care, because access to care is very important. But without this data and being able to have that available to not only leaders, but to those that are at the bedside or managing, we will be able to improve access to care, improve patient outcomes, and ultimately drive our business. But I think more importantly is, why should healthcare accept a lesser degree of what's important to care for patients? For example, a pilot in aviation, how long has it been that a pilot would never fly a plane without the right instruments for situation awareness?
Right.
To know how to safely fly that plane with especially cargo on, right? People on board that they have their lives for. So why is it okay that healthcare, and we in healthcare think it's okay to use old data, even if it's two hours old, to try to manage and care for patients in their lives? We shouldn't be. Healthcare, it's now that we need to have this, and it should be an expectation for healthcare systems like Northern Light Health and everyone else to say, this is what we expect now. Our clinicians expect this, executive leaders expect this, that we have to have real-time data, the analytics and the predictive analytics to be able to, frankly, drive and fly that plane that we have precious cargo on board, and do it well.
Right. That's a really profound way of thinking about what we do all the time. And so you've brought up data and analytics, and we've talked a lot about that's standard leadership practice now. So as clinicians, we talk about our system of record is the EHR, is working in electronic health record, and now we've got a leadership practice around data and analytics that's different than it was a couple of years ago. And you were already planning very strategically data governance analytics practice at Northern Light Health. This is now another strong part of that toolkit you're building. Can you talk to me a little bit about guidance you have for other CIOs, chief digital officers, who are thinking about their journey in real-time health system, but also in analytics and data governance?
Yeah, so I would say to others, data is a strategic asset, just like any other strategic asset that the health system has. So know how to use it, know how to care for it, and manage it, and then incorporate it into workflows.
Right.
It should not be an afterthought. It should not be something that says, geez, I'd like a report about that, or do we have data? So that is really important as we evolve our data governance. One, it's not owned by IT. IT is very important. Informatics is very important, but it's a strategic asset that our healthcare leaders realize the importance of how it needs to be used, cared for, and managed with data governance principles, rules, very important. And so I think that is one thing that I would really make sure that people start to really change their thinking and incorporate it into your workflows. So in your strategy, it's got to match your strategy. And so how are you going to use it within that strategy in workflows for leadership?
Yeah.
We have workflows for clinicians, nurses. What is your workflow, and how do you use it?
Yeah.
What's your workflow for medication administration, and then how do you use a scanner in that process, right? We have workflows for that. We have data around that. We need to have the same with data analytics. So what is the workflow?
Love it. That's fantastic. So thank you so much. As usual, we're at time. The time flies whenever I speak to you about this, and so I'm really thankful for your time. Thank you everyone for joining us for this live stream. Can't wait to talk to you about this topic again.